how does this product help with atherosclerosis?
Cardiovascular disease is a complex disease with multiple causes. Not every patient with atherosclerosis has had the same reason to develop atherosclerosis. There are smokers, there are patients with diabetes, there are patients with high cholesterol, there are patients with high blood pressure, and each of these causes different molecular mechanisms by which atherosclerosis is initiated. We have dozens of novel risk markers in cardiology that can be analyzed in specialized laboratories and that are being promoted by these laboratories these days. Elevated homocysteine, C-reactive protein, and many more blood markers are being used to better diagnose the risk of heart disease and stroke in an individual subject. Although all of these markers influence the process of atherosclerosis in different ways, the major common pathway that leads to the buildup of plaque is A, the lack of nitric oxide, and B, chronic inflammation in the blood vessels. A lack of nitric oxide production from L-arginine is indicated by an imbalance between L-arginine and its endogenous competitor, asymmetric dimethylarginine, which is abbreviated ADMA. After 20 plus years of research into the role of ADMA as an opponent of L-arginine, and after almost a dozen large clinical studies with more than 15,000 participants, we have come to develop a blood test that allows us to measure both L-arginine and ADMA in blood, and thereby determine a person's individual need of L-arginine supplements. Interestingly, the lack of NO production from L-arginine, which is often caused by accumulation of high concentrations of ADMA and the oxidative inactivation of NO by oxygen radicals in the vascular wall, as occurs during chronic inflammation, are linked together. When you have chronic inflammation in the blood vessel, the inflammatory products that are generated will kill the nitric oxide and prevent it from working. When you have a primary cause that reduces nitric oxide, and nitric oxide normally is kind of a brake on inflammation, you loosen that brake on inflammation. The inflammation will flare up, so these two are connected with each other. The product that we have developed, Arginine Cardio, tackles this nitric oxide issue from both sides, based on a deep scientific understanding of the mechanisms of disease. And it is certainly the strongest product to promote protection of both the blood vessels and the heart.